If you're dealing with leg pain, even though you're stretching, you're doing exercises, it can feel confusing and frustrating, especially when you're doing what you were told should help. Many people are told their leg pain is caused by a tight muscle or a disc issue, but that doesn't explain why it keeps coming back. In our clinic, we see this all the time. Patients follow their exercises and treatment plans, yet their leg pain does not fully resolve. Most of the time, it's not because the care is wrong, it's because there's certain daily habits that are quietly keeping the spinal nerves irritated throughout the day. The issue is rarely one bad movement or one mistake. It's usually a series of small, repeated positions that your spine doesn't tolerate well over time, even when you're exercising correctly. In this video, I'm going to show you 5 everyday habits that may be making your leg pain worse, along with simple fixes and micro resets for each one. These are practical corrections you can use right away to reduce nerve irritation, relieve the leg pain, and stop undoing your progress between treatments and workouts. Hey, I'm Dr. Paul Barnwell, chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life that they want, using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so they can live with confidence and purpose. If you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgeries being recommended without a real plan, this channel's for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what's actually happening inside your body, what actually helps it heal, and information most people never hear in a routine doctor's appointment. Subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move forward with a life of less pain and more purpose. I upload a video every week. Okay, to understand why these habits matter so much, we need to start with one overlooked rule about how the spine responds to daily stress. Your spine doesn't tolerate asymmetry well over time, not for hours, not for days, and definitely not every day. Most people think the spine fails because of too much movement. In reality, it usually fails from uneven loading done over and over again. Leaning slightly to one side, sitting with your weight shifted, standing on one hip, carrying things on the same side every day, ladies. None of this feels dangerous in the moment, but nerves are very sensitive to constant irritation. When one side of the spine is loaded more than the other, the nervous system never really gets a break. Blood flow changes, pressure builds, sensitivity increases, and suddenly the leg pain feels random, even though it's not. Here's an important tip. If a position feels comfortable but you stay there too long, it can still be a problem. Comfort does not mean neutral. Comfort often just means ongoing stress on your spine. Here's another key point that people miss. Exercises cannot override 8 to 10 hours of asymmetry. If you train for 20 minutes but you sit slouched, twisted, or shifted the rest of the day, the nervous system listens to the longest exposure, not the hardest effort. That's why people feel better right after therapy or exercise and worse later on. The treatment helps, but daily, habitual positions quietly undo the progress you made with the treatment or exercise. Once you understand this, the focus becomes clear. Instead of chasing pain, you start removing the daily habits that keep the nerve irritated. So let's go over the 5 mistakes and how to fix them. Okay, so mistake number 1, slouched or one-sided sitting. Leaning slightly to one side, sitting on a wallet, holding your phone off to one side. None of this feels dramatic in the moment. That's why it gets ignored. Over time, though, these small shifts load one side of the spine more than the other. That uneven load keeps the nerve irritated, even while you're sitting and resting. Here's how to fix it without overthinking it. When you sit, bring your hips all the way back in the chair. Place both feet flat on the floor so your weight is evenly distributed. Add a small lumbar support to gently remind your spine where neutral actually is. If you want to take it one step further, use a simple micro reset. A slow 30-second seated pelvic tilt works well here. This is used to restore movement, reduce stiffness in the lower back, and help relieve pressure on the nerve that causes pain while you're sitting. Mistake number 2, staying in one position too long. Once you fix your sitting posture, the next issue is what happens when you stay in any position for too long, even if it feels good at first. You might be thinking, my posture's good, so why do I still have pain? This is why. Even good posture becomes a problem when there is no movement. We see this all the time with desk workers who sit for hours and retail workers who stand or walk all day. The spine and the nerves do not like the stillness. When you stop moving, blood flow drops, pressure builds, the disc stays loaded longer than it should. Over time, the spinal nerves that trigger leg pain become more sensitive, not because you did something wrong, but because it never gets a break. The fix here is simple. Stand up and move every 30 to 45 seconds. Put a timer on your phone. Even 60 seconds counts. Take a short walk. Changing positions in your chair helps too. Here's a micro reset for this habit. 10 slow hip hinges or a brief walking reset. Stand tall, hinge at the hips while keeping your back and spine stacked. Then return to standing. Move slowly and stay relaxed. This is enough to restore blood flow and help unload the disc without too much pressure on the spine. So mistake number 3, twisting during everyday movements. Next, we need to talk about what happens when people twist their spine during everyday movements without realizing. This habit shows up in very normal moments, reaching into the back seat, picking something up off the floor, turning while carrying groceries. None of this feels dangerous at the time, but over the course of the day, it adds up. When the body rotates without the feet and hips moving with it, shear forces build in the spine, repeating this pattern, keeping the nervous system on high alert, even if your workouts and exercises are solid. The fix starts with awareness. Turn your feet and your whole body together and keep your spine stacked as you move. This spreads the load more evenly and reduces stress on one side. This doesn't mean you need to be a robot, but if you're already dealing with a problem and we're trying to heal that problem, then we want to make sure to reduce the shear forces. Here's a micro reset for this habit. A simple standing anti-rotation hold, often called the Palloff press. Stand tall with your feet shoulder width apart and your spine stacked. Hold a light band or a cable in front of your chest, press it straight out, and hold for 10 to 15 seconds without letting your body twist. Keep your ribs, pelvis, and shoulders facing forward. This is not about building strength. It's about teaching the nervous system to control rotation and resist shear forces during these everyday movements like lifting, reaching, and turning. This is especially helpful for disc-related leg pain because it protects the spine during the exact motions people repeat every day. Mistake number 4, hanging on one hip while standing. Now we're going to look at the last habits that tend to show up when people are tired, when they're distracted, maybe you, carrying extra weight on one side. Habits that quietly load the spine while standing and undo progress while you sleep. One more habit we see all the time is hanging on one hip while standing. You see this when people are waiting in line, while you're doing the dishes, scrolling on your phone, or holding a child. If you carry kids, purses, or bags on one side, this habit is sneaky and destructive. All the weight shifts to one leg, glute stability shuts down, and one nerve root stays loaded for hours at a time. The fix here is simply bringing your weight back to center, putting it evenly between both feet, let your hips stack over your feet instead of collapsing into one side. And here's a micro reset for this habit. Shift your weight evenly onto both feet and gently squeeze your glutes, your backside, for 5 seconds, then relax. Repeat this 2 or 3 times. This turns the glute muscles back on so they can do their job as hip extensors, which takes the stress off the low back muscles that often overwork when you hang on one side. When the glutes are doing more of the work, the spine and nerves are under less constant strain. And mistake number 5, sleeping curled or twisted. The final habit happens at night. Sleeping curled up or twisted often feels comfortable, but it keeps the spine out of neutral while the discs are trying to rehydrate. That poor position quietly stresses the area every night, which is why so many people wake up stiff or already irritated. The fix here is support, not forcing yourself straight. If you sleep on your side, place a pillow between your knees to keep your hips and your spine aligned. If you sleep on your back, place a pillow under your knees to reduce tension and keep the spine neutral while you rest. Here's a micro reset for this habit. Before getting out of bed, take 30 seconds to gently rock your knees side to side or slowly bring one knee at a time towards your chest. This helps you to restore movement reduce morning stiffness, and ease pressure on the nerves before you start your day. Once this habit is cleaned up, you stop undoing your progress overnight, which is where many people get stuck. Okay, so now you have a clearer picture of what may be keeping your leg pain going. Most of the time, it's not one big injury or one big bad movement. It's the small daily habits that quietly irritate the spinal nerves over and over again. So take a moment and think about your own day. Which one of these habits shows up the most for you? Leave a comment and let me know. I know for me, it's that standing on one hip. I do it all the time. I got to catch myself. So if this video helped you recognize those patterns, hit the like and share it with someone who might be dealing with the same frustration. And if you have questions or you want clarity about how this applies to your specific situation, leave them in the comments below. I do read them. Be sure to subscribe if you want clear explanations that help you understand your body, fix your habits that matter the most, and move towards a life with less pain and more confidence. The next video you should watch is this one, L4, L5 disc bulge, 5 exercises that I teach every patient for fast relief. Go watch that video next. I'll see you next time.